Good evening and welcome to Conversations Live, sports-related concussions. I'm Patty Satalia. Recent research shows that sports-related head injuries are much more complicated than we first believed and may cause lasting consequences to players' health. Tonight we'll talk about sports-related concussions and our panelists welcome your phone calls. Our telephone number is 1-800-543-8242 and our email address is connect@wpsu.org. You can also send us a question on Twitter. Find us under the address @WPSU and use the hashtag WPSU Conversations. Now let's meet our guests. Ruben Echemendia is a neuropsychologist and clinical director of the University Orthopedic Center's Comprehensive Concussion Care Clinic in State College. He's also the president of the Sports Neuropsychology Society. Dr. Wayne Sebastianelli is an orthopedic surgeon, chief of staff for Mount Nittany Medical Center, and the director of sports medicine at Penn State. And joining us by telephone from Boston is frontline reporter-producer Jim Gilmore, whose most recent investigative documentary, League of Denial, the NFL's Concussion Crisis, premiered this week on PBS stations. So thank you all so much for joining us. And I'll begin with you, Jim, assuming that many of our viewers and listeners tonight watched that documentary 2 nights ago. What was the impetus for producing that piece?
Well, we had been looking at the subject for many years. 4 or 5 years ago, we almost did the program, and in the end, some of the folks that we were talking to said there was a lot of change and it wasn't the right time, that it might be something that we could revisit. This time around, it was a co-production in the beginning with ESPN, and ESPN came to us suggesting a co-production. There were 2 ESPN reporters, Steve Fainaru and his brother Mark Fainaru-Wana, who were writing a book, which came out at the same time, and we sort of viewed this is a good opportunity to do an important story in connection with a lot of folks that we wouldn't normally pull in as an audience, folks that were ESPN viewers.
There are some people who think the goal behind League of Denial was for people to boycott the NFL. What's your response to that?
Not really. That was not at all sort of the idea that the and if you talk to a lot of the doctors that we dealt with in the production of it, and the reporters that we talked to, and there are no football haters in the bunch. The idea is not to kill football; it's to get involved with a debate that's necessary to have out there because this is so important. And to see if the game can be changed to make it safer for professional players as well as kids and high school players and college players out there. The debate is essential to have. Okay.
On that note, I want to say that to people listening, you sound like you're talking to us from Mars. You're not actually talking to us from Mars. There's a lot of reverberation. You're talking to us by telephone from Boston. But you bring up an important point. We've been talking about this really for 15 years or more, but I still think there's confusion about what a concussion is. Ruben Echemendia, explain what happens to the brain when there's a concussive injury.
Sure. Well, a concussive injury really results from an acceleration or deceleration of the brain inside the skull. If you think of the brain floating inside the skull in cerebrospinal fluid, when that skull gets hit and the brain gets hit, they accelerate at different rates, and you get a moving back and forth of the brain inside the skull. That movement then creates some changes in the brain, specifically some biochemical changes, which alters the functioning of the brain cells.
Jim Gilmore just said, Dr. Sebastianelli, that the impetus for creating or producing this documentary was to see if we can't make the game safer for professional athletes all the way down to children. How do you do that?
It's definitely a culture change. It's something that has to start at a very early age. Appropriate techniques need to be ingrained in the athlete's participation, regardless of the sport, whether it's rugby, football, ice hockey, doesn't matter, soccer. The athletes need to recognize what some of the symptoms and what some of the problems are associated with mild traumatic brain injury and report those accurately so that an appropriate intervention can occur so that repetitive subconcussive injury doesn't continue.
Most states do now, including Pennsylvania, which I think signed on in their number 31 or 35 in the nation in establishing laws around school sports and concussion. Generally speaking, Dr. Sebastianelli, what should happen if, regardless of the sport, a concussion is suspected?
I think first and foremost, the athlete needs to be discontinued in participation on at that very moment that it's been recognized that a concussion occurred, regardless of the level of participation, whether it's Pee Wee football to NFL football. If a concussion has occurred, that individual is really should be done for the day. And then based on age, there will be different criteria of participation and return to play as symptoms resolve. So the adolescent brain is going to be treated much different than the adult brain. And the female brain, particularly in the adolescent, is going to be treated even differently than the male brain. And Ruben's done a lot of work on that stuff.
So explain why is there a difference between the female brain and the male brain when it comes to concussion?
Well, we're really not sure what exactly are causing the differences. There is thinking that it has to do with the mechanism of the injury, and that is that the male neck may be stronger, and in strengthening the neck and having a tighter connection between the head, the neck, and the core, then there's less of that acceleration, deceleration. There are also differences in terms of hormonal changes among women versus men. And we also know that the brain of women is organized in a different way than the brain of a man. So that too may have a relationship with it, but we're not exactly sure what variance is being attributed to any one of those individual components.
Jim, one of the experts prominently featured in your documentary, Dr. Ann McKee, said while she can't make a proclamation for everyone, her advice is that no one under 14 should be playing tackle football.
Right, and it wasn't only Ann. Dr. Cantu at BU, as well as Dr. Omalu.
At Boston University.
Right, at BU. Also feel the same. I mean, that's, of course, the big question is kids under the age of 14, because of what the doctor just has stated, they have a different makeup. The necks are also weaker in boys as well. And the real question becomes, what age does it really become safe? And there is this attitude out there that before the age of 14, it's just so questionable at this point on what we know that perhaps it's best that they don't play. One other thing I just might bring up quickly is the thing that was confusing to me along the way, and as I was learning more during the making of the film, is how difficult it is to really understand what a concussion is, and what a lot of the doctors that we spoke to in the film kept on bringing up is the fact that the normal concussion, that what we think of a concussion, is hard to really evaluate, and that repetitive head trauma, like what the guys get on the line in a football game, which don't seem to be a real concussion where the symptoms are not dramatic, over time, all those hits also has an effect. And the real question is what happens over the years when you've gotten hit in the head on every Sunday or Saturday afternoon repetitively with huge amount of force.
In fact, in the documentary, you talk about Owen Thomas, who was 21 years old, had never actually presented or officially been declared to have had a concussion, and yet on autopsy, his brain showed these tau proteins and CTE, chronic traumatic encephalopathy. Maybe you could explain what exactly that is and why that's what we're looking at so closely, Dr. Sebastianelli.
Well, we're not really sure exactly what it is, other than the fact it's a pathologic finding on gross and microscopic analysis of a brain that's been involved with head injury. It's a deposition of an abnormal amount of protein that occurs in areas of brain trauma. It leads to complete dysfunction of those areas, so that if the pathways involve memory, the memory is affected. If it involves balance, that's affected. It is something that probably has some form of genetic predisposition, so that an individual that is sort of prone to concussions will build that sort of activity, that protein level up in their brain. just as some individuals may be more prone to Alzheimer's disease, or some people may be prone to Parkinson's disease based on genetics. There's probably some predisposition to this that we just haven't quite figured out. And there's been some genetic studies that have been looked at, like apoprotein E4, where we definitely recognize that that brain is more susceptible to injury, but we don't know if it means that they're going to get chronic traumatic encephalopathy. So it's still not completely figured out.
Okay, we're going to take our first phone call and then come back to some of that. Betty is calling us from Conneaut Lake. Betty, what's your question or comment for our panel?
Well, I was wondering for some time now why they still have the hard outer shells on the football helmets, and why haven't they gotten a more absorbed
something that would absorb shock better?
Yes.
Okay.
I'm on the inside line, but I wonder just about the hard outer shells. I would think they would do some of the damage.
Okay, Ruben Echemendia, you've looked at helmets and whether they're effective or not. What can you tell us?
Well, that's an excellent question. And it's true that if the helmets were made of more absorbing material, they would absorb the blow rather than transmit the blow like a hard polycarbonate shell that we have right now. The problem with that is that helmets, our modern helmets, are designed to protect against skull fracture, laceration, and other types of penetrating head injuries. And for that, they do a wonderful job. The mortality rate due to brain injury and those types of injuries has almost been eliminated in football using these types of helmets and in other sports. What the biomechanists worry about at this point in time is that the tension between protecting against the skull fracture and the penetrating head injury and the lacerations, and protecting against concussion, because we don't have a material that's able to do both at this point in time, and it's a risk-benefit trade-off going back and forth. Hopefully, as helmetry design moves forward, we'll be able to integrate the two to have something that is able to absorb some of the blow while at the same time dissipating it throughout the helmet so it doesn't cause that translation of the blow.
In the meantime, though, there's a helmet, the Rydell Revolution, that has lots of parents especially thinking that their child is protected from concussion. And as a result, I think people play differently, thinking they've got protection that they don't really have.
You're absolutely right. There is no empirical evidence at this point in time that any of the helmets that we have available to us actually reduce the incidence of concussion. They're not designed to do that, and in essence, they don't do that. And you're absolutely right that there is this perception of what's called risk compensation, and that is the more warrior-like we make ourselves, the more protected we are, the more willing we are to engage a risk to hit harder and to possibly cause an injury where otherwise we wouldn't be doing that.
And add to that the fact that the game is more intense than it's ever been, not just at the professional level, but also in high school, where players are bigger and faster and stronger. And so I go to you, Jim Gilmore, because one of the things you touch on in League of Denial is really the physics behind, for instance, for professional football players who are getting 1,000 to 1,500 subconcussive hits per game, and then perhaps 15 or more throughout a 15 or so long career. What does that mean? What is in terms of impact, what does a football hit on the field today mean?
Well, one of the folks that we talked to in the film, Dr. Stern, again from Boston University, I think defined it in a startling way, which was that the hits that people get on the field are often like the effect of 20 Gs, which is like driving into a brick wall at the speed of 35 miles per hour. And that's happening about 1,000 times a season, which is pretty impressive. The thing that other people tell us, which is pretty much anybody you talk to that is close to the game, that is on the field, is just how startling the violence is. The guys that are playing today, as you said, are much bigger. They're also much faster. The talent out there is amazing. And when they hit, it's like every single time they hit, it's like an automobile accident. It's startling, everybody says.
Mm-hmm.
Now, Dr. Sebastianelli, you actually recall a concussion that you got as a football player back in 1975 playing for Rochester University. How did people react back in 1975 versus what you're seeing on the field today?
Oh, completely different. Essentially it was once you were able to follow a finger and track and count backwards from 10 and were able to stand on one leg, you were allowed to go back in regardless of whether you had headache, photophobia, nausea.
Did you go back in that day?
Absolutely. Absolutely.
And any long-term consequences that you're aware of?
Hey, I asked my wife, she may tell you that, but personally I don't know of any. But it's completely different. And to highlight what Jim just said, first of all, there's no concussion-proof helmet. Second of all, the kinetic energy is what it's all about. And the game is played in so much space today so that people get to full speed before the impact, whereas when I played the game, it was 3 yards in a cloud of dust. You didn't really have the same speed that would occur on every play. But nowadays, with spread formations and people in motion and those kind of things, those bigger, faster athletes are now at maximum speed when they actually hit each other, and that's where part of the problem is. The second thing that I want to highlight is that age is very important, because if you look at the data from the NCAA versus high school, the incidence of concussions is vastly greater at the high school level. And I think it's because of the physical mismatch that occurs. So age 14 may be the right age. I can't tell you it is or isn't, but the most important thing is that the physiological development of that individual is what's critical. Whether it's 16, whether it's 18, whether it's 12, is going to really depend on that individual. So creating an age range is going to be very challenging to do that.
Your point that you just made has a lot of people wondering about Penn State this season, for example, where we've got true freshmen playing, and they're playing against guys from other teams who are ready to enter the pros. So how dangerous is that, given what you just said?
Well, fortunately, most of those kids, even as freshmen, are really adults. So it's not going to be as critical in the sense of comparison and contrasting someone who's 16 versus someone who's 12. And if you're playing Division I sports, at 18 you're a man or you're a woman. I mean, you've really developed faster and much more and matured much more appropriately to play that sport than you would at the high school level. But a senior in high school who's not at Division I level talent and is playing against the senior in high school who is at Division I level talent is a huge mismatch. But that's not going to occur as frequently at the college level.
Right.
There's a small but not insignificant study that came out of Virginia Tech and Wake Forest that showed that the impact that a 7-year-old gets to his brain playing tackle football has the same magnitude of what's happening to the brains of adults playing in high school and college. Can you comment on that?
I'm familiar with that study, and I think that those are interesting findings. There's a lot of speculation involved in that because you have to create a model or theorize a model for the child brain versus the adult brain. I would probably argue that the impact forces in a child brain are greater than the impact forces on an adult brain for a number of different reasons, and the ability of that brain.
Inertia is one of them.
Right, and the size of the head and the relationship of the head to the neck to the trunk, and also the ability of the brain then to deal with that injury, to be able to compensate and use other areas of the brain to be able to do the same function may be different. And it's probably quite different in those children than it is in adults. So I'm not sure that I quite understand the relationship the way that they do.
I'm going to take a phone call in just a minute, but I'm wondering, in your view, Dr. Sebastianelli, how important is the NFL's admission or denial of a link between head trauma and future long-term consequences? How important is that in terms of what happens at the college level, at the high school level, and even below that?
Well, I think it's very, very important, and the reason is that we all tend to look at the highest level of anything and use that as the pinnacle of what the model should be for performance, for safety, for recognition, for treatment, any kind of adjective you want to use or any kind of process you want to use. So I think it's really very critical that that recognition is made and that it sort of flows downhill. And I think they've done that already with their ads in the sense of, see what you hit, tackle appropriately, good coaching techniques. USA Football is really working on all of those campaigns, and it will eventually work, but it's going to take time. And coaches at those levels need to be appropriately trained so that they are engaging the sport with the right technique.
Okay, I'm going to talk about technique in a moment, but if you are just joining us, I'm Patty Satalia, and this is Conversations Live, sports-related concussions on WPSU TV, WPSU FM in Central Pennsylvania, and on WQLN TV in Erie. Our guests tonight are Ruben Echemendia, a neuropsychologist and clinical director of the University Orthopedic Center's Comprehensive Concussion Care Clinic in State College. Lots of C's in the name of that. Dr. Wayne Sebastianelli, an orthopedic surgeon and director of sports medicine at Penn State. And joining us by telephone from Boston is Frontline's Jim Gilmore. He is co-producer of League of Denial, the NFL's concussion crisis. Our telephone number is 1-800-543-8242, and our panelists are ready to take your calls. If you'd prefer to email us, or our address is connect@wpsu.org, and you can also send us a question on Twitter. Find us under the address @WPSU and use the hashtag WPSU Conversations. And now we go to Tom, who is calling us from Waterford. Go ahead, please, Tom.
Yes. Hey, that's great. You guys are, heavy hitters there. Could you tell me what the, if I drop to my knees, what is the force equated to? Just a human being dropping to their knees. What's
from
the
a standing position? From a standing position?
Well,
yeah,
I mean,
because I'll tell you, you can tell me this later, but in 1980, when I started my construction business, a friend of mine was working with prosthetics, right? And I said, I didn't play any football. I want to save my knees. And he gave me a pad in my leather. He made me a leather knee pad. And he said that this material could be hit with an 8-pound sledgehammer and you'd never feel it. And I've used that since 1980. And my knees are fine. I mean, no problem. But I'm dropping to my knees in construction, and I'm just trying to see what the physics is. This is a material that, by God, I'll tell you, worked for me. It was about a 1/4 inch thick. It was a pad, and it was made for amputees. And I'm intrigued by this because the physics of it.
Well, basically, I'll highlight what Dr. Echemendia said before. It's all about acceleration and deceleration, and the brain moving inside the skull. So you can drop to your knees, and your bone is really going to accelerate and decelerate, and it's not going to really have much reverberation. But inside the skull, where the brain is sitting suspended by membranes and sitting in water, it's going to bounce off the back and bounce off the front, or if there's angular acceleration, it's going to rotate inside and create shear. They're the kind of things that can't be stopped. The woman earlier asked about why not put soft material on the top of a helmet. The problem with that is that increases the coefficient of friction for the impact, so you're going to get neck injuries and all sorts of problems, because instead of glancing, things are going to collide, dig, and twist, and probably create more neck trauma than you really want. So you trade one problem for another, and it's a very challenging issue.
You've said, Dr. Echemendia, that it's the blows to the side of the head, to the side of the jaw, to the side of the face that you're most worried about, or that are most problematic. Why is that the case? Well,
as Dr. Sebastianelli just said, there are two types of forces. There's a linear force and there's a rotational force. That rotational force causes the brain to spin on its axis. So the brain is spinning at a different rate than the skull is spinning. And that type of spinning can have very key strain at very key juncture areas of the brain, which are the center of the brain, at the lower ends of the brain, the more primitive ends of the brain that control a lot of our more primitive functions. So that rotational blow can cause all sorts of problems, and we've been finding that the rotational blows tend to be related to the more severe types of injury. They're certainly more related to the more sensational injury like loss of consciousness.
Which brings us to something that you bring up in your documentary, and that is teaching young players today how to fall and how to hit. Can you, Jim, talk a little bit about the NFL has given, I think, $30 million to the Heads Up project?
Right. I mean, and that is definitely a positive thing. It's trying to take the head out of the game. And that's the big goal. I mean, some people argue you can never take the head out of the game. If you just look at footage of any football game, when you have people running at each other, even if you're trying not to hit heads, an elbow or a knee or something hitting a head can do just as much damage. So, but certainly it is one of the important advances. The other thing I might say is that with this whole question about the leather protecting, one of the points that some people sometimes talk about is the fact that would the players actually be safer if they were wearing leather helmets, because what that would force them to do is not to use their head as a weapon, take more care in what they were doing, because what really happened with the invention of these wonderful new modern helmets is people started using their heads because they knew that they wouldn't break their skulls open, and that in some ways has caused a lot more damage than it's helped.
Interesting point. One of the things on your website that I found of real interest was the concussion watch.
Yeah.
And you had that up last year, and last year there were 171 official or confirmed concussions in the NFL. So far in week 5 of play, I think 36 concussions.
Right,
Can you
36.
extrapolate and tell us, if you think things are getting better, or what that means for this year?
It's hard to tell. I think we're only 5 games into the season. What it does seem to say is that things aren't improving radically. That things are pretty similar to 2 years in the past, even though the NFL has already made some changes, like on kickoffs and stuff. So the real question is, how many more changes? What else needs to be done? Because 36 concussions in 5 weeks is a worrisome number.
And of course, you're only reporting regular season concussions, not what might have happened during the practice season.
Right, and the NFL has, of course, cut back on full contact practices, which is also a good thing. But you're right, a lot of the damage to players' brains has been taking place during practices, and this, again, is a very important thing in high schools and colleges. And in the younger kids playing. And one of the things I noticed, I was talking to a friend here in town where I live in Massachusetts, and there are a lot of communities that have not learned the lesson of the pros at this point, and they're still having full contact practices every time the kids are out there. So as much as most things trickle down from the NFL, a lot of some of the advances that they've been involved in recently has not trickled down as of yet, and that's a very important thing.
Ruben Echemendia, you have been looking at the NHL's concussion rate since, I think, 1997, and Rule 48, I think, was designed to help reduce the number of concussions in that sport. Has it made a difference?
Well, Rule 48 in the NHL was designed to protect against blindside hits to the head, because we knew from our research that blindside hits to the head were accounting for a significantly large proportion of the injuries. Since Rule 48 came into effect, the number of concussions from blindside hits to the head has actually decreased dramatically. One of the things that I wanted to get to, though, is that tracking the number of concussions is actually a fairly complicated process, because one thing is to say that we have an increase in concussions, and we see that dramatically throughout the country. We're seeing it across all different sports.
Especially in high school sports.
Especially in high school sports, but in large measure, that's probably a result of our increased ability to detect the injury. As we're changing the culture, athletes are beginning to report their symptoms more often. Medical staffs are better trained at being able to identify the injury. So if we do our job well in education, the number of concussions should go up. By definition, it should go up, because we are going to get closer and closer to the true incidence as opposed to the minimization of the symptoms that we were having earlier.
Okay. We have a phone call from a former NFL player, Kenny Jackson, who's calling us from State College. What's your comment or question?
Yes, my comment. How you doing, Mr. Bassinelli? I think you know who I am.
Yes, I do, Kenny.
How you doing?
I'm great, man.
I'm watching your show here, and I'm really interested in, when I was in high school, I had a brain injury where I got hit pretty hard, and I had a burning sensation, and I was walking around, didn't know where I was at, kind of knew, kind of didn't. Compared to when I was in pro football, where I got hit in the side of my head, and when I was playing with the Houston Oilers, I got a knee to the side of the head, and I was out cold. And I heard the one gentleman there speaking with you discussing the difference. Because the one that I got hit in pro football on the side of my head, I was out for about 10 minutes. Now, it didn't burn, but I had one in high school where it burned. I mean, it literally, I walked and thank God I was okay, but I was only in 9th, 10th grade. And of course, at that time, we didn't talk about it like we do today. So I wanted to see the difference between the burning sensation or the pro when I was in pro while I was out cold, and I didn't feel like I was in any kind of pain.
The fact that he had that first concussion made him more vulnerable when he got the second one, didn't it?
I think the data does show that once you have one, you're more susceptible in the future. But it sounds like the mechanism for the second concussion was significant. You know, the burning sensation could have been two separate things. One could have been the concussion, which wouldn't really necessarily give you the burning, but the second is that you could have also had a cervical cord concussion,
wow,
which is down lower. It depends on which level the brain actually saw the rotation and the shear. And you can get a transient quadriparesis if it's real severe, where you can't move any extremity, or you can get that burning sensation almost like you've hit your funny bone and your fingers are on fire, and it goes down into your legs or your arms, depending on which part of the cord is involved.
Kenny, did these hits make you pause and think you might not want to continue as a pro football player?
It was so different then. I'm glad you people are talking about this discussion because, you know, being that I played pro football, I'm lucky I got a lot of people that can help me with the NFL and so forth. But my worst concussion, where I remember it, I was a young kid in high school. It never, you know, we were taught to be tough.
Mm-hmm.
And, you know, Doc knows what I'm talking about. When you get hit, you know, you put a little smelling sauce on. It's like anything. You can get to the sideline, you sit down. The coaches knew, you know, we just didn't know the effect. And then when I got in pro football, it was in the, you know, early 90s, and I got, you know, I had a couple at Penn State as well. When I got in pro football, it happened. They did a good job. They put me to the sideline. I did not play again. But in high school, this is where the diagnosis, where I'm concerned, where the diagnosis is not there. Today, like the gentleman was saying, people discuss it more. Back then, we never did, oh, you got your bell rung. We put a little smelling sauce on your nose, and then we take it from there. But I thank God that you guys are doing this because it's making so many young people. I was lucky. I got to the final level. And you don't think of not playing anymore because your adrenaline's flowing. You know, it's such a big game. You know, everybody loved it. It gave me a scholarship. I wouldn't have went to college without football. Right. You know, and so you're doing everything you can. Your friends love it. Your family loves it. But I'm just so glad you people are discussing it because it's very, very important because the things you worried about as a player with knees, because then I can't play forever. Sure. I can play, you know, I'll get my head wrong. I'll be okay in a day or two. Right. Or maybe in a half hour.
Jim,
I was lucky enough to coach, too.
Well, Kenny, thank you. Stay on the line for a minute. But Jim, you know, Kenny is describing just how intoxicating playing football is. Our culture absolutely loves it, and part of what they love is the violence, and I'm wondering if that will change when they see, you know, what the potential risks are. I'm just curious to have your comments on what Kenny is saying.
I think certainly the violence of it is intoxicating, but the game is a great game, and you can make it safer, and it still will be a fascinating, great game to watch. So I think that's certainly no problem. I think what Kenny was talking about is also very important, of the fact that how this macho aspect of the game and how you're taught to be tough. I mean, that's in the pros, of course. It's not only being tough, but it's also your livelihood. And if you can't withstand the pressure of the game, you're not going to stay in the pros for too long. But what the message sent down to the college kids and the high school kids is, you know, the pro guys, that they're heroes, and they look up to them, and they expect that's the way you're supposed to play the game. And I think that's a very good thing that's changing now, because there's more conversations about all this, is that, you know, to ignore your injuries, to go out and play injured is a really dumb thing to do, and it's not showing you're more of a man. it's basically going to lessen the amount of time you can actually play the game because you're going to injure yourself more severely.
Are you seeing what Jim's talking about on the field, Dr. Sebastianelli? Are players more inclined to say, okay, I'm going to sit this out without arguing with you about, no, I got to get back in, I got to get back in?
Well, I think it's definitely getting better in the sense of the understanding and the lack of argument. And actually, as an NCAA, program, sports, the athletes have to sign an affidavit stating that they will report their symptoms. And I have to say, over the last 5 to 8 years, we get more reporting from teammates saying, you better look at Johnny, or you better look at Sally because something's not right. They're asking questions about assignments that they shouldn't ask. They should know what's going on. So clearly, I think the pendulum is swinging in the sense of people becoming more comfortable either self-reporting or reporting for their athlete. You have to remember that you may be concussed and you may not know that you're concussed, and you may continue to try to perform but you don't know that you're concussed, so you just keep going along, and that's where the teammates need to come in and help.
What do you both look for when you see someone take a hit on the field to determine whether or not they've been concussed, or even if it was a subconcussive injury? But I'll begin with you, Ruben Echemendia. What do you look for?
The first thing I look for is any kind of dazed, any kind of vacant look, any sensation that they're not processing the information around them the way that they normally would process that information. And then just tracking them, seeing whether they appear confused on the field, whether they don't know their assignments or they're missing their assignments, or whether, simple gestures like they're grabbing their head, they're holding on to their head, what we call some of the visible signs in concussion. Motor incoordination when they're trying to get up and they get the Bambi leg approach where it's just hard for them to get their stability. Those are the kinds of things that I look at as initial indicators that a concussion may have occurred. Not that it has occurred, but that it may have occurred, so that means we need to go in and evaluate.
And your motto and the motto in the NHL and elsewhere, if in doubt, sit them out.
Right. Absolutely.
Okay, and what would you look for, Dr. Sebastianelli, and what would be the protocol if you do suspect that someone had a concussion?
I think Ruben's identified what we would look for. The protocol is basically to take the helmet from the individual, to literally put them on the clock, and watch them carefully. Get a baseline assessment of balance and cranial nerve exam, and give them some memory function tests and so forth, and within several minutes repeat some of those things, and within 15 minutes certainly repeat it. But I think if you get to that level at this point in time, they're probably concussed and they need to not perform the rest of the day. Prior to a couple years ago, I think people would still give them a 15-minute window of clearance and then probably return them. I think we're becoming much more aggressive in the sense of controlling the environment, not letting them return to play with those kind of symptoms.
And it's not enough just to take them out of play. You say working on a computer, all of these things that are taxing to your brain are equally damaging.
Absolutely. When your brain is injured, it's not functioning real well. And unlike a knee, like a joint, another joint, we can't ice it, we can't tape it, we can't do any of these other things. So we need to allow the brain to rest. Because if the brain doesn't rest, it is continuing to use up the resources that it would otherwise be putting towards healing. And by using up those resources, you're prolonging the symptoms that you're going to have, and you're prolonging the amount of time that you're holding the player out of play. So the sooner we get in there, the sooner we intervene, the sooner we start the healing process, the more quickly this injury is going to resolve, and the more often these players are going to be able to play.
All right. We're going to go to Ken, who's calling us from State College. Ken, go ahead, please. You're on the air.
Gentlemen, aren't we dealing with what is an inherently dangerous sport in which concussions cannot be avoided? They're going to occur, and despite the best efforts of people to try to minimize the number of concussions and the extent of the damage caused by those concussions, they're going to occur. It's as though the college, the NCAA, and the Professional Football League are marketing an inherently dangerous, defective product in which there is a known danger that these concussions will occur. And it is a voluntary activity that our children, our 18 through 22-year-old college players are engaging that they don't have to engage in. We have 107,000 people in Beaver Stadium cheering these young men on to vie for victory and glory of old Penn State, but they don't have to be there. And they probably shouldn't be there when they know that there is a high possibility and likelihood that they're going to have a serious head injury. And the discussion tonight seems to ignore the fact that you are in fact dealing with an inherently dangerous product that is being sold by the NCAA for millions and millions and millions of dollars of revenue every weekend, along with the NFL. Thank you.
All right. Thanks for your comment. Any comment to his comment?
I'd be happy to answer it. I mean, I think your point is heard. I don't think that there's anything that in life that's going to be without risk. I think these are educated individuals that have put a lot of time and effort into training appropriately. With that said, I'm not minimizing the fact that there's concussions, and what we're trying to do is recognize when one occurs and to interfere with the process of repetitive subconcussive injury or recurrent injury that occurs because the brain is still vulnerable. You have to think of this as once a brain's concussed, it's like it's starving for energy. It's sort of like trying to run a marathon without eating your carb-loading diet 24 hours before. Your brain does not have enough ability to process information, and it's more susceptible to injury. So although we're not going to prevent every concussion, it doesn't mean that the sport should be banned. What it means is that recognition needs to occur, culture changes need to occur, rules changes need to be made. They need to be enforced appropriately, and serious recognition of what long-term consequences that are starting to be identified but not completely figured out need to be taken seriously, and we need to appropriately act on that.
And Patty, if I could, I think what Ken brought up is, of course, a hugely important question.
This is Jim Gilmore, one of the producers of League of Denial. Go ahead, please, Jim.
Certainly the film, if people take a look at our film, one of the major things we're looking at is the way the NFL has dealt with this over 2 decades, and we have a lot of question about what they knew and when they knew it, and how they didn't live up to their responsibility to their players, but more than that, to youngsters playing out there. But the question of concussions is a tricky debate, and we go into it, and there's multiple answers to it, and the brain, of course, is unbelievably complicated, so there are no easy answers. But the thing that we do bring up in the film is that, you know, the fact that there's 46 NFL players now at this point that have had their brains dissected, and this disease, CTE, which is a problem with the tau protein in the brain going awry, has been found in 45 out of the 46 players. So it's a considerable number. We probably will not know for sure the causation and the exact prevalence until scientists figure out how to find the disease in living players. And that's certainly somewhat close by from what a lot of people are saying.
Yeah, I just read about 2 players. I'm hoping I can remember their names. Fred McNeil of the Minnesota Vikings and Wayne Clark of the San Diego Chargers. They both ingested nuclear medicine and had their brains scanned, and these tau proteins did show up in their brains. These are 2 people who played football for quite a long time. Wayne Clark, though, doesn't have any signs of dementia, and Fred McNeil, who's 5 years younger, has advanced dementia. What does that mean to you, Ruben Echemendia?
Well, it speaks to the complexity of this injury and the complexity of the brain. Tau proteins don't show up only with CTE. Tau proteins show up in other areas and for other reasons. What is important about the work that they've done in Boston and the work that Bennett Omalu has done is to identify this pathological condition, this neurodegenerative disease. The problem is we don't know who gets it. We don't know why they get it. More importantly, we don't know who doesn't get it. and we don't know at this point in time ways to prevent it. So
the only thing is that, for instance, Dr. McKee, I have to argue this
Sure.
point because of what some of the folks said in our film. What Dr. McKee said is that she's dissected thousands of brains, and the only brains that she's ever found that have this tau protein in the way that it appears in this disease, in these football players, is in football players. It doesn't appear in anybody else. And tau, it's not like Alzheimer's disease. It displays itself in a different way. So it's very clear to them, to some of these scientists that have been looking at it for quite a while now, that it is pretty clear that it is caused by repetitive head trauma, the type of repetitive head trauma that takes place in football.
And she seems to think if you could test every single living football player, you'd probably find some of this tau protein in their brains.
Well, just a point of clarification. What Ann McKee has done and what Bob Cantu have said is not whether or not there is presence of tau protein or not, but that CTE has a specific demarcation of tau, or how tau deposits itself in the brain. For example, at the base of the sulci around the blood vessels. They would not argue, I don't think, that tau can be present in conditions other than CTE.
Right, and I mean, it is, in fact, it definitely is. They do argue the way it collects is significant and is defined in CTE.
Right, but the point that came up earlier is just that the simple presence of tau in the brain doesn't necessarily mean that that individual has CTE.
And that's why Wayne Clark, who seems not to be suffering from any long-term consequences at age 65, according to the article I read. I want to go real quickly to Ellen, who has been hanging on patiently. We don't have a whole lot of time. Ellen from Hollidaysburg, what's your question or comment, please?
It's a sports injury-related question. The daughter is a Division I, or was a Division I basketball player with 2 concussions during her career, and recovered from both of them. And a year and a half later, this July, was in an auto accident where in South Carolina. It was a double rollover. She rolled twice sideways, didn't lose consciousness, but the ER did not diagnose her with a concussion. In fact, they didn't even take her. She had to take herself. And she wasn't really diagnosed with a concussion until a month later when she sought treatment, and is still having symptoms. I just wondered if you find this to be as expected, and why wouldn't an emergency room physician assistant be trained to diagnose a concussion?
Your chief of staff of Center Community, tell us what your reaction is to that.
Well, I think it's all about, I think, being suspicious that a concussion may have occurred, but it actually gets to a point that I wanted to make earlier when Kenny was on the phone. You may think that the more severe concussion involved loss of consciousness. That is absolutely not the case in many instances. Sometimes it's just a simple, not that the rolling over twice was simple, but there's certainly a lot of energy in that. But she probably did not hit her head enough to make herself unconscious, but had more angular acceleration that created shear that stimulated or stretched some of the areas of brain that were previously injured from her other concussions, and created the chronic post-concussive symptoms that she's having right now. And at the time of the accident, the ER physician may have been more focused on, blunt chest trauma, significant Glasgow-Coma scale scores, which she didn't have because she was obviously conversing and her eyes are open and so forth. So it's something that at times, again, with the epinephrine that occurs with the accident, she may not have really presented with a lot of those symptoms.
Well, what can she do now? I mean, how worrisome is it that she wasn't treated for a concussion a month ago?
Well, I think it gets back to what Ruben said about the relative rest for the brain, and those kind of things continue to consume energy resources that have led to her post-concussive symptoms. So there are some things that need to be done. I'll let Ruben's an expert on that.
What can she do now?
Well, first is to get to somebody who specializes in the area of concussion, who understands this injury, to begin now to disentangle what are some of the difficulties that she's having and why she's having those difficulties. Because as time goes on in post-concussion syndrome, we then start to see an admixture of a lot of other components, a lot of other variables. Very often anxiety comes into play, depression comes into play because they're not feeling well.
Physical, emotional, cognitive.
There's physical, there's emotional, there's cognitive, and all of these then start building on each other. And you need someone, and she needs someone to help her disentangle that and begin the process of dealing with each one of those issues as they occur.
All right, thank you, and best of luck to you. We go quickly to John from Kane. Go ahead, please, John.
Yes, this is my question. I'm a firm believer that the helmet increases the use of the head as a weapon, and the helmet is the weapon. I want to know if anybody has thought about studying rugby players who don't wear helmets and see what the incidence of their brain injury is compared to that of football players.
Very interesting.
I've watched hundreds of sandlocked kids play football without a helmet. I have yet to see anybody go head-to-head.
Ruben Echemendia?
It's a very good point, and we mentioned earlier that that risk compensation issue is important. But rugby does have a significantly high level of concussions.
He just hasn't seen them.
Yeah, he just
Okay.
hasn't seen them, but I see rugby players all the time, and I know Dr. Sebastianelli sees them all the time. And it's a big issue in those countries that play rugby routinely, New Zealand, Australia. There are lots of efforts trying to be made to manage concussions in those areas as well.
Okay. I want to quickly go to an email question that we got just a moment ago. Let's see if we can get that up here. An email question. Do we have that? Yeah. Nikki writes, my brother suffered 2 concussions when playing football when he was 10 and 14. Even blood came out of his ear. As a result, he was edgy and depressed. These past 40 years, he has insomnia. What services are out there to make him feel better besides a psychiatrist? Wow. Ruben Echemendia.
I would go back to what I just said, and that is that to get someone who's expert in the area of concussion, whenever you get to somebody who's having multiple symptoms and they've had symptoms for a very long time, the only way to effectively treat it is with a multidisciplinary team. You need to be able to pull in physicians, neuropsychologists, psychologists, psychiatrists, physical therapists to deal with vestibular issues. There are a number of different things that are going on, and you need to bring all of the expertise of those different disciplines to bear in order to help the individual.
And we know a lot of people who are suffering the way this young man is. You know, we're reading about pro football players who have committed suicide, who have suffered from insomnia, from agitation, from depression, from the same things that this young man is suffering from. Dr. Sebastianelli, anything to add to that?
I think it's just being aware that all these things can occur, and to encourage freedom of reporting the symptoms. Avoid what Kenny said, which is, you know, it's a badge of honor to have a concussion. Right. You know, it means you're tough if you got up and walked it off and went back into the game like I did when I was playing college football in the 70s. And those kind of things, that kind of behavior needs to change. We can't have that any longer.
Okay. Jim, we just have a couple of minutes remaining, but I'd like your final thoughts on what's the take-home message? What do you want people to get out of this film, and how would you like to see them move forward?
Well, one thing I would add to what Wayne and Ruben just said is I think also dramatic change to the game needs to be made, and I think it's absolutely important that this debate is ongoing. I think it's absolutely important that parents of children who are playing the game better understand the risks, and the kids better understand the risks. And I think that's the most important thing. And I think more pressure needs to be brought on the NFL specifically, because that's who we dealt with, to make sure that they don't do what they have been doing for 20 years, which is try to ignore the problems and to be much more progressive in the attitude towards how to change things.
One of the things you point out in your film, Jim, is there's a conversation that Dr. Amula has, his first face-to-face meeting with a physician from the NFL, and the physician says, do you know the consequences of, or the implications of what you're saying here? And he said, yes, I do. Yeah, you know, he did. Then the the physician persisted and finally said, okay, what are the implications? And he said, if 10% of mothers in this country consider football dangerous, that will be the end of football. And with just a minute remaining, Dr. Sebastianelli, is the end of football imminent?
I don't think so. I think it's a great game. I think it's something that has a lot of history, has a lot of passion. And I think that I agree with what Jim said. There's a lot of things that need to change, particularly rules, particularly enforcement. I mean, you just look at the onside kick and how that play sort of targets one poor soul, you know, to try to keep a ball from getting into the hands of another. And that's a play that there has to be a better way for us to figure out how to give a team an opportunity to get the ball back without killing somebody.
10 seconds for some final thoughts from you, Ruben Echemendia.
I agree with Jim. I think keep the conversation going. That it's a complex area. We need to learn more about it, and we need to talk more about it, and we need to open up people's eyes.
All right. Thank you all so much for joining us. Our guest tonight, Ruben Echemendia, a neuropsychologist and clinical director of the University Orthopedic Center's Comprehensive Concussion Care Clinic in State College. Dr. Wayne Sebastianelli, an orthopedic surgeon and director of sports medicine at Penn State. And Frontline's Jim Gilmore, co-producer of League of Denial, the NFL's concussion crisis. For resources on tonight's topic, visit our website, wpsu.org/conversationslive. And we hope you'll join us next month when we'll discuss the future of healthcare. Thank you all for watching and listening. I'm Patty Satalia. For all of us here at WPSU, have a good night.